The best of Money Matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin Jeong. Now, 2 years ago, Foundation Healthcare was little more than a bold vision, an ambitious dream to reimagine private healthcare here in Singapore. Fast forward to today, and that dream has evolved into a thriving, fast-growing network of clinics, specialists, and innovative care solutions. At the heart of this transformation is a clear purpose to build a connected, sustainable, and patient-first healthcare community. From launching the Health Connective Programme to expanding its specialist network and opening new centers, Foundation Healthcare is not only scaling, it's shaping the future of care. So what does it take to turn a vision into a movement in healthcare? And how do you keep purpose at the center of rapid growth? Well, joining us today to share more is Karen Lee, who's the Director of Partnerships at Foundation Healthcare. Hi, Karen. Welcome to the show.
Hi, Hongbin. Thank you for having me.
Thank you so much for joining us. Karen, just to start off here, what was the vision behind Foundation Healthcare's inception?
Yes, the few of us who have come together to put together Foundation Healthcare, we were really, in a sense, driven by what we saw in terms of how fragmented the private healthcare ecosystem was. Right? When you think about the private healthcare ecosystem, you have the patients, you have the doctors, you have the hospitals, you have the payers. So it seems all very complex. But maybe if I could just make it a bit simpler, right, in terms of how we could understand this a bit better, right? From the patient's perspective, they'll be thinking, okay, I really want to get my problem fixed. I want my loved one to get the conditions fixed, right? But who should I go see, right? Who's the right doctor to see? What kind of insurance coverage should I get? And what can I actually be covered for, right? So there are like all these questions. And then from the doctor's perspective as well, they're trying to think about, okay, how best can I maintain and run my business? But then also as a doctor, you want to really focus on practicing and you want to focus on doing what's right by the patients. Right. But how do they have such meaningful conversations with the insurers? So I think we were seeing that in terms of how private healthcare was going, there was a lot of fragmentation, and we really wanted to build like a sustainable ecosystem, right? We wanted a platform where we were building bridges between the different stakeholders. We wanted patients to feel connected with doctors. We want doctors to feel like they can speak to payers. So that's how Foundation came about. We really wanted to see how can we build a more connected and sustainable private healthcare ecosystem.
Okay. So how does Foundation Healthcare differentiate itself from traditional private healthcare providers in Singapore? Is what Foundation Healthcare doing, did it not exist before Foundation Healthcare was born?
Yeah, so if you think about how private healthcare was maybe before Foundation came, you would have the usual, I would say, healthcare groups. So you would have the hospital groups, for example, right? The facility providers or who own the hospitals. Then you have smaller specialty groups as well. They're like some of them are practicing as like solo doctors, some practice like 5 doctors, but they still largely practice in terms of like smaller groups. And then you also potentially have like the health tech companies. You're really thinking in terms of how best to piece the different stakeholders within the ecosystem together, right? For us, we are really, in a sense, a purpose-built platform trying to cover all pieces of the ecosystem, right? So in a sense, we have a large group of doctors with us, but we are also looking at how best to solve some of these problems. So technology is a very big piece for us, right? Technology is not just like an afterthought, but it's more in terms of how do we use technology to solve some of these problems? How do we bridge the different ecosystem players together? And also, if you think about the facilities piece, we are also in that sector, but we are asset light in the sense that we don't own hospitals, but we own day surgery centers, right? So when we think about it, we're really building a holistic ecosystem where all the various components important for bringing value or value-based care to patients are, in a sense, are pieced together.
All right. Well, from 53 to 92 specialists and expanding from 52 to 68 clinics, what factors have driven this rapid growth for Foundation Healthcare, you think?
Yeah, so I think healthcare is an industry where I think there needs to be a lot of trust between like the doctors and the management team. There needs to be a lot of trust between the patients and the doctors as well. So I think how we've managed to grow relatively rapidly, I think there are two key points. One is that I think the management team that came together from Foundation Healthcare have had a lot of experience within the various part of the private healthcare ecosystem. So we have, I have teammates who have run hospitals before. I have teammates who have run insurance companies before as well. So we know intimately in terms of what the problems within the private healthcare ecosystem is. So I think this lends a lot of confidence to doctors as well, because they know that they are working alongside a team of of a management team who is really helping them to focus on the business part of medicine. Right, the doctors, they can just focus on the practicing of the medicine, but they trust that they are working with a team who takes care of their other needs as well.
Right.
I think the second piece is also that with all these relationships and the trust that has been built over the past 10 years, 15 years, in our interactions with the various doctors. The first group of doctors who have joined us, they also have that vision that they're trying to build a different type of private healthcare platform, right? They are also thinking in terms of how best can I future-proof my practice? How best can I make private healthcare more sustainable? We hear a lot about like increasing healthcare costs, increasing premiums. They are really thinking about how best can they work together as a group to achieve something that's more sustainable as well for them as a community.
Very interesting. Well, what does sustainability mean in the context of private healthcare, and how is Foundation Healthcare integrating it into its operations?
So sustainability is actually something very, very, very key and critical to the formation of private healthcare. So when we think about sustainability, we think about it in two ways. One is really from the perspective of how best do we continue to deliver value-based care to patients, right? So from the perspective of accessibility to patients, from the perspective of cost containment, how do we look best at making sure that patients can still have the option to access private healthcare, understand what their options are, and also be able to seek that best care. So when we think about how we include sustainability in our practices, it really governs, in a sense, everything we do, right? So when we think about the strategy in terms of how Foundation is growing, the reason why we work with specialists and we're also looking at ambulatory care centers, for example, as an area of growth, is because we know in other countries, some of the procedures that are done in major hospitals can actually be done in a day surgery setting. So when you think about cost and like affordability, right, that really provides more options for patients and also, in a sense, provide more sustainable options as well to patients.
Okay. Well, I also want to talk about the Health Connective Programme that you guys have. I mean, it's described as a first-of-its-kind care coordination platform. What inspired this development, and how has it transformed patient care so far?
Yeah, so if I may borrow an analogy from another industry, maybe the travel industry, right? Like 20 years ago, if you had to book at a hotel or book a trip, right? That wasn't booking.com, trip.com, right? You didn't really know, for example, which hotel was good. You couldn't even see the pictures of how the hotel was going to be like.
Yeah,
and then
you might just go to a travel agency.
Exactly. Right? So I think we're really borrowing from that idea that I think patients, you want that understanding in terms of which doctor you're going to, which facility you're going to, and you also want to feel that your care is being coordinated through one single platform. So Health Connective really, in a sense, tries to piece together the various providers and various stakeholders within the healthcare ecosystem. So what it means for the patient is that, right, if I need to find a doctor, I can go to the Health Connective platform. I know that they will be able to find me a doctor that I can trust. And then secondly, I can find a doctor that I can trust who I can also, in a sense, afford the services for because the doctor is on my insurance panel. And then beyond that, we are also looking at integrating the entire episode of care for the patient. It's not so much about, okay, I just take care of your single problem, right? You see this specialist. But after that, you may, for example, need to follow up with a GP. So Health Connective is really that connector, right? It's that platform where I do all the coordination for you. And then I build bridges through our technology platform. I allow the GPs to be able to communicate with the specialists. I allow the specialists to be able to submit claims effortlessly to the insurance, for example. So it's really building that bridge.
Very interesting. I mean, with over 5,500 appointments arranged through the Health Connective Patient Assistance Center, what kind of feedback have you received from patients and providers?
Yeah, so we've been very humbled and overwhelmed with the feedback so far. It's been very positive. I mean, for the patients, I think they really appreciate just having one point of contact to coordinate all their appointments, to coordinate their benefits as well, right? So I think most of the patients have been very appreciative of the program. From the care provider side, whether it's a specialist or the GPs, it's also been positive because I think for the GPs, sometimes they're also not too aware, for example, which specialists are on which panel, and we don't really want the GPs to go through that administrative process of trying to figure out how best to find a partnering specialist for their patient. So the feedback has been positive as well. I think for us, it's also really about receiving and getting all this feedback in terms of how best to further improve. So, for example, some of the patients have actually asked, right? Like, if you want to book a movie now, you can just go gb.com, you can book a movie ticket. But it's quite difficult to do that for healthcare, right? So real-time appointment booking is something that we've received feedback for and we're also working on.
Very interesting. Now, you've onboarded over 126 GPs and 12 allied health providers into your network. What role do these partnerships play in building an integrated and sustainable healthcare system?
So healthcare is really, I would say, is an ecosystem where you really need all the different partners to come together because there's no one player who can take care of the needs of all the patients, right? So we've always been very active in terms of looking for like-minded partners who are willing to partner us in terms of the care journey. So because we're largely a specialist-based group, it's important for us to also partner GPs because they're really also the gatekeeper of care. And we do want, for example, the patients to be able to go back to their GPs after seeing our specialists to make sure that their care is continued in that sense. Even for allied health professionals, that partnership is very important as well. Increasingly, as we look at developing more clinical programs, things like weight management, digestive diseases, right? It's not so much about just seeing like a surgeon or a GP, but I would also need a dietitian, right, to help me plan in terms of my meals, right? So that's how we're really thinking about that whole coordination of care for the patient.
Okay. Now, the upcoming imaging center in Novena and the day surgery center later this year marks a significant step. So what strategic needs are these new facilities addressing in the current healthcare landscape?
So in terms of our expansion to like the day surgery centers as well as the ancillary services, that's going to be, that will continue to be a key area of growth for us. We see that with the aging demographics, etc. And there is also that need that we see from patients where they want quick access to treatment. They want fast turnaround. So for example, the imaging center that actually just opened, we put in an AI solution so that the scans are done half the time. In half the time, right? For the day surgery centers, they're also located near the hospital, so it gives patients more options. If they do want to get a treatment done, they have the option of doing it in a more cost-effective facility, for example.
Okay.
Yeah.
Also, it looks like Foundation Healthcare is in the midst of finalizing an agreement with Great Eastern. How do this collaboration align with your mission to make private healthcare more accessible and cost-effective?
So in terms of our partnerships, the partnerships with payers, like Great Eastern is also very critical, right? It's a bit like, if I could borrow the travel agent's analogy again, right? If you're thinking about where to travel to and what hotel to book, that, for example, if it's your grad trip and your mom is the one paying for the trip, your mom might say, oh, you can't go to like a 5-star hotel, right? So this relationship with the insurers is key because they actually define or guide a lot of the treatment pathways for the patients as well. So with this collaborations, it actually grants more accessibility to the Great Eastern policyholders. They'll be able to, for example, see our specialists. They'll also be able to definitely enjoy some benefits at our facilities. But more importantly, what we're really looking at is a bigger picture. How do we look at better cost containment in partnership with the insurers, right? It's not so much about just like the doctor's fees, but how do we really look at it at the total costs perspective.
So with a potential fundraising round on the horizon here, what areas of growth or innovation are you most excited to invest in next?
Yeah, so for us, we're definitely looking at expanding and deepening our areas of growth. So definitely we'll still continue in terms of expanding our specialist panel, building up more day surgery centers, etc. But we're also very excited in terms of growing regionally. So some of the Southeast Asian countries, we have started some partnership discussions as well. So that's where we're hoping to grow. The other piece that we're also very excited about is really the technology and data perspective. With the Health Connective platform, with more partners coming on board, we also see that we would be able to, in a sense, partner more ecosystem partners to develop more, I guess, I would say patient-centric solutions, right? With all this data, we can better know how to coordinate care for patients throughout the ecosystem. Yeah, so I think that's something that's very exciting for us.
Well, speaking of looking ahead, how do you envision Foundation Healthcare continuing to reshape the private healthcare landscape over the next 5 years?
Yeah, so I think similar to maybe Booking.com. We can't even remember like time before such travel platforms, for example, right? So we're also hoping that we really just want to make private healthcare something that's simple and accessible to the general public, right? So it shouldn't be so difficult for patients to know where they should go or who they should see. So we definitely hope that with our various partnerships and our solutions, we can make private healthcare more accessible and valuable for the public.
Amazing. Yeah. Well, thank you so much, Karen, for joining me today.
Thank you. Thanks, Hongbin. Thank you.
That was Karen Lee, who is the Director of Partnerships at Foundation Healthcare. This has been The Right Business with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.